Hi, everybody. Thanks for joining. Just waiting for Ben to join us. Good evening, Ben. How are you?
Hello, I am well, thank you.
How are things in Idaho? Are they springing into action? It's not Idaho, Utah.
In Utah, yeah, well, I could have answered the question the same way because they're so close. Yes, it's wonderful. Spring is finally coming, but boy, it has been a long winter. But that means the skiing has been quite delightful.
Oh, okay. Nice. Well, thank you so much for joining us this evening. It's evening in the UK. I think it's just about afternoon for you. And good morning to anyone else joining from anywhere else. So welcome, everybody. This is our first Instagram Live as public health collaboration. So we're very excited about that this evening. Just to introduce myself, I'm a trustee at the public health collaboration, and I thought I could, before asking you, Ben, to introduce yourself, just give a little bit of an introduction into who we are. I'm conscious that maybe people are not aware of us. So we are a UK-based charity that exists for the sole purpose of helping people understand the concept of and the importance of their own metabolic health. And we're a group of people that are very passionate about that. And we really believe that people do understand it and are able to understand the power of eating real food, that they'll be able to take control of their metabolic health and live optimal, healthy lives. So that's why we exist. We have we've been around since 2016, so we're in our 7th year now, and we have might have heard of Dr. Unwin, who's the chair of our scientific committee and who is a large contributor to our extensive website, where there's lots of resources that people can find out more about metabolic health and get some really handy information, some tools and resources to work with and to help them. But our main event each year is actually our annual conference, and so we're coming up to that this year for 2023, and it's going to be in Sheffield, which is around the middle of the UK, and it's going to be in May, in the 19th and 20th next month, so really close now. And we are absolutely delighted, given that we are all about metabolic health, that you're able to join us this year, Ben. And we're hoping that between now and when the conference is held, that we're able to have just to give everyone a bit of context, a few other Instagram lives with other speakers, so that people can get a bit of a sneak peek into what's coming, and to find out a little bit more about maybe some of the speakers they're less familiar with than Ben. So that's kind of why we're holding this Instagram Live, is to really start interacting with the public, so that people are able to support us and understand some of the concepts that we're hoping people like yourself, Ben, who are renowned for investigating them and researching them, can help us spread that message when you come to our conference. So thank you again for taking the time to join us. And if they have any questions, thank you. And if you have any questions, anyone online, if you could insert it into the little speech bubble with a question mark, that would be where we'd be able to spot it, and hopefully we can get some of those answered as well as we go. So without further ado, Ben, would you mind just starting us off by just introducing yourself? I'm sure you need no introduction, but just a little bit of background into your specialism, your work, and your interest in this space.
Of course, yeah, I'm delighted. And let me just also start by saying how absolutely thrilled I am to be participating in the event. I've long been familiar, well, since its inception, with the PHC, and have really been an advocate for it, albeit from across the pond. And the fact that I can now be there in person and contribute, make my small part, I'm thrilled. I'm a research scientist, and I'm a professor, which I just really enjoy. I enjoy teaching undergraduate and graduate courses at a university, but similarly, I enjoy doing research with these students and trying to find answers to questions. And it is my great delight to study an area of research that people tend to be interested in. It was a number of years ago, if you'll allow me to deviate for just a moment. A number of years ago, I asked myself a series of questions, and I wondered whether the information in my brain was valuable. And I thought that it was. I answered that I think it is important what I know. And then I wondered what's the best way to share that information. And for a scientist, the way we share information in my field is peer-reviewed manuscripts that are published in science journals. And I sort of had to laugh at myself, acknowledging that that is not the best way to share information. That while I need to do that for the sake of my scientific career, I thought the best way to do this would be to find channels that would allow me as a biomedical metabolic scientist to speak directly with people. And the fact is, social media, like we're doing right now, in my mind was the best way, and I still believe it is. But there's nothing quite like being in person, and that's why I'm so thrilled to be at the PHC event in just a couple of weeks. So that's my career. My focus is metabolic scientist, as I noted. And I study primarily insulin resistance, and I won't get ahead of myself, but that's something I certainly will be speaking about at the PHC event. But when people hear insulin resistance, often they don't, one, understand what it is, and two, they don't appreciate the relevance of this problem, where this is the single most common health disorder in the world. And it's not just some kind of American problem. It is indeed the problem, the metabolic problem in the US, and it's admittedly better even in the UK, but both countries are far from being the worst. Looking across Asia and the Middle East, where there's much higher rates of metabolic problems than we have. Nevertheless, it is a global problem, and that's what I've devoted my career to understanding. What is insulin resistance? Where does it come from? And why it matters? And what to do about it, which is always the kind of good news at the end of a scary story.
It is, and certainly I think I know myself and many others on our personal journey have very much found that the information that you have shared and taken away from, you know, the scientific literature, as you mentioned, has been absolutely invaluable. And I think it's also, you know, a credit to you as someone who's a scientist, because I think there are many scientists out there that aren't necessarily able to bring it to the layman in a way which is understandable. And I think that's what's so important about having experts like yourself involved in these conversations, where it is directly in social media, directly to the public, so that people can take this on, because ultimately this is a challenge in people empowering themselves and understanding this information themselves, and not relying on the traditional maybe kind of route of getting sick and then taking medication, etc. So the more they can understand that the system can work differently and that they're in the driving seat, I think the more we can actually spread this message about metabolic health and the importance of it. And I think just to pick up on your point there as well, Ben, about insulin resistance, it's very much fitting with the theme of our conference this year, which is called "This is How We Fix the NHS." And for those of you not in the UK, the NHS is it's almost our pride and joy. It's our public health system, which is fairly unique across the Western world, that we have a fully funded, tax paid, free at the point of use healthcare system, and it's nevertheless still under strain at the moment. And we really believe that if we can help people understand the concept of metabolic health and to take control of their own health, that we have the solution and the most sustainable way of actually retaining and saving our NHS and taking some of the burden away, because 80% of what the NHS is dealing with are these metabolic illnesses and these chronic illnesses. And that's a huge amount. Like, we spend £10 billion a year on type 2 diabetes, about 7 billion on cardiovascular disease, 5 billion on cancer. I mean, the list goes on. They're all the big numbers, are all the metabolic illnesses. So it doesn't have to be that way, and we don't need to pour more money into it. We need to think about how to bring that cost down. So we know that the message that you can bring to the conference, Ben, is very much about how all of those illnesses are they're not hereditary, they're not inevitable that you're going to get them, they're not all separate things that just happen to be. They're all connected through this concept of metabolic health, and which is underpinned by insulin resistance. So thank you for helping us bring that message out, as you said. So is there anything that you can share with us about what you will be talking about without telling us all the information, but just enough so that people get the idea of what you're going to be sharing and get excited about it?
Yeah. So I kind of mentioned the outline, which is stating the scope of the problem, which we've both been touching on here, and then defining the problem. And maybe I'll speak a little bit on that, where when people hear the word insulin resistance, they commonly only think that this is something I'll mention, so I'm going into a little bit of the talk. They'll only think that I'm talking about diabetes. And what's funny about that is that sentiment is so deeply instilled in people's minds that when I wrote my book a few years ago, about all of this, I had first thought, well, I will call it something like, what is insulin resistance and why does it matter? But I knew no one would read it. They would just look at that title and think, I don't have diabetes, I'm good. And so I needed to make it a little more sexy, if you will, which is hard for a bald, freckled, skinny guy to do. But I tried my best and called it Why We Get Sick, hoping to convey this idea to the individual that what we're talking about here, and what I will be talking about, is a common soil that, while all of these chronic diseases, things like heart disease and diabetes and fatty liver disease and migraine headaches and Alzheimer's disease, while all of them are indeed distinct problems, and they do indeed have distinct iteology or background, they all have one thing in common, which is insulin resistance. All of them, in part, are noxious weeds springing from the same little spot of soil. So it's this common soil sort of view or perspective of it all. But there's an outcome that I would imagine, and this very much applies to the NHS and individuals within the UK and of course elsewhere, where one of my hopes is imagining the person who would open up their medicine cabinet every morning and take out their pills for their blood pressure, take out their pills for their diabetes, take out their pills for their migraine headaches, and more, and then learning that all of these, in fact, can be addressed through lifestyle changes. And talk about cost savings, talk about easing up this financial burden on the NHS and the US and everywhere else. If we can get people to look at these not only to view these problems as sharing a common origin, and then addressing that common origin, thereby reducing the risk of all of these diseases, then we have not only improved people's lives immeasurably, but then also financially, perhaps saved potentially broken or bankrupting medical institutions, or in the US, individuals. And that is done through diet. The food we eat is the culprit or the cure. None of these metabolic problems are a result of not having a certain pill in your system. They are a result of how we live our lives, what I call these plagues of prosperity. These are problems that our great-grandparents knew nothing about, and now they're killing us. They are a result of how we live our life. So it is how we live our life, albeit differently, that solves these problems. And this is the kind of primer or the larger view of what I'll be addressing.
Yeah, that's really great. And I think even thinking about it from the public's point of view, to have the knowledge that looking at worrying about all of these potential illnesses that may come your way later in life, and trying to imagine what you should do to prevent it, well, actually the solution is more simple than you think, because they're all connected, and if you just focused on one thing, you're suddenly unlocking potentially the ability to prevent yourself getting all the other things. So I mean, that is something which I think people would find very empowering, because it's not an overwhelming challenge to try and have great health. It's actually quite feasible, because it isn't as complicated as maybe you would think.
That's right. Well, and moreover, let me just add one other thought. This, I believe, in the UK, as it is in the US, the most common medication that people are put on, if there is any kind of diagnosis of a metabolic issue, is metformin. And the problem that metformin, while being one of the better drugs, it is still a drug. And every consequence, the moment that pill goes in the mouth or that needle pokes your skin, this is, for lack of a better way of describing it, something that is not natural to the body. And there will be everything that happens thereafter is a consequence. And it is simply a matter of the individual, hopefully very educated in this, to weigh or balance these consequences. In other words, asking themselves, are the consequences I don't want offset enough by the consequences that I want? Because it's all consequences. And so metformin, for example, which is the most widely used drug worldwide to improve insulin resistance, most people don't know that part of its mechanism of action is by damaging the mitochondria. And while there are so many zealots almost, if you will, who are promoting the use of metformin for all kinds of things, it literally undoes the benefits of exercise. There are human studies that have been published finding that when you exercise, you improve your mitochondrial function. When you exercise and take metformin, it undoes the mitochondrial benefits of that exercise. And so every clinician who's trying to get their patient to improve their metabolic health would give a hearty encouragement to engage in some frequent degree of exercise. And at the same time, they will happily give a prescription for metformin, not appreciating the fact that metformin will reduce the ability of the mitochondria to work, undoing some of the mitochondrial benefit of the exercise itself. Well, that's a hell of a trade-off, and people need to be aware of it.
Is that something that the medical community tend to know when they're prescribing metformin? No?
No,
Okay.
all of this is work published from, the work I'm familiar with is a group at Colorado State University, so here in the U.S. I can't remember the lead author's name now, but it's anyone who's curious, you can easily find this. Go to Google Scholar and type in exercise metformin, Colorado State, and you'll find it.
Okay. Thanks, Ben. So that's so insightful, and I can't wait for you to tell us more about all of that at the conference. And hopefully, lots of people online will be able to join us. And I'll also provide some details if you aren't in a moment or so. So just moving on to the rest of the lineup. I think maybe you've hopefully had a chance to have a look at it, Ben. But we're so excited about our lineup this year, and we've managed to secure some fantastic speakers from around the world and from within the UK, and we are covering quite a few topics that we have never covered before at our conference. So we haven't talked about Alzheimer's before, and I know you're on the panel for that. And we haven't talked about cancer before, and I think you're on the panel for that too.
I am, yeah. They're putting me everywhere.
And some other great conversations that we have set up for day 2, where we are going to talk about the benefits of exercise, where that comes in and how that relates to diet. And we're also going to have a conversation about the value of plants in the diet. And we have Sean Baker and diet doctor and Anthony Chafee and a plant-based doctor, Dr. Chidi, and Patrick Holford, all having that discussion, which we think is going to be a very different way of sharing information that we normally would do at a conference, and also maybe fill a gap in the public's knowledge about how to compare such contrasting messages that we hear about plants and meat. So we're excited about that, and we're also talking about the effect of cows on the environment. So we're trying to do some of the surrounding topics to some of the messages that we're putting out there. So I wondered whether, from your point of view, looking down the lineup, which are you interested in, apart from the ones that you're obviously within?
I'm certainly a little biased to a man with a hammer. Everything's a nail, so I see metabolic everywhere. I'm delighted. I will just say I'm particularly thrilled to see the Alzheimer's one, the Alzheimer's panel in focus. I'm not an Alzheimer's scientist, although actually I've published some very high-profile journals in high-profile journals on that very topic. But I think the louder we can be to help people understand that Alzheimer's disease is not a disease of plaques. That is the problem with the traditional view. Yeah. That idea has been, and it was a big to-do in the U.S. Well, it should have been bigger, where a couple of years ago, an anti-plaque Alzheimer's drug was submitted to the FDA, the institutional approval board, if you will, in the U.S. for drugs. for approval to be used and given to people to help improve Alzheimer's disease. Interestingly, this drug was found to reduce plaques. But at the same time, it had no detectable improvements in cognition. And so the special committee, which is how the FDA works, they invite specialists to review the information from a drug, and then the FDA will make the final approval. The committee that the FDA had put together to review this drug rejected the drug. They said that the incredible cost of this drug, combined with the fact that there's no demonstrable improvements in cognition, we have to reject it. But the FDA approved it. Now, I don't mean to sound like a conspiracy theorist, but part of their motivation in the FDA, which is quite insidious, was that they didn't want to discourage further drug development into Alzheimer's. And so they approved a drug that they knew didn't work. At least if we're defining the disease by how well someone thinks and behaves. So what if you reduce plaques in the brain if it doesn't improve the disease? And this was just, in my mind, a cherry on top of what is already this very large cake of problems, where we've known for years that people will die without any hint of Alzheimer's disease, no hint of cognitive decline, and yet they have plaques in their brain. And there are other people who die with profound cognitive decline, and they barely have any plaques in their brains. And so the idea that this is a plaque problem has been built on a very, very sandy foundation. Indeed, as was revealed within the last year, it was probably all built on falsified data in the first place. So this is my long-winded way of saying it's high time that we look at another perspective or explanation for Alzheimer's disease. And while the plaque-based theory of Alzheimer's disease is crumbling, another structure is being built quite rapidly in its place, which is the idea that Alzheimer's disease is simply a manifestation of a hungry brain, that where the body is becoming increasingly insulin resistant, insulin is less capable of moving glucose into the brain to be metabolized for energy, and that leads to the brain being hungry, a problem that is called brain glucose hypometabolism. Well, thankfully, the brain has another energy source in the form of ketones. Just most people eat in such a way that they never have any ketones, because the more you're spiking your insulin, not only is it contributing to insulin resistance, but to make matters even worse, you're also inhibiting the body's ability to make ketones. So it's like the brain, it's a sort of metabolic version of an old famous sort of poem, The Rime of the Ancient Mariner, where the sailor is tossed at sea and becoming dehydrated to the point of death and bemoaning the fact that he's surrounded by water and he can't drink any of it. Well, this is like the brain who's surrounded by glucose, but there's not a drop for the brain to drink. It can't get to the glucose, and it's crying out for the ketones as its sort of life raft. But the body, we're not allowing the body to make ketones. So the brain is starving in the midst of plenty.
Absolutely. And obviously, we hear these days about Alzheimer's being referred to as type 3 diabetes. Do you think that's something that's catching on? Are people starting to appreciate that?
Yeah, well, I'm certainly hearing people talk about it more. I'll confess though, that I don't love that name, because it implies that it's something different than just insulin resistance, which is what type 2 diabetes is. I prefer, although I appreciate the term simply because it points the finger at a metabolic issue, but I would prefer it be just called insulin resistance of the brain.
Okay.
Not that I'm correcting you. You and I can call it whatever we want. But as the term starts growing, there's a little part of me that winces a little, because I worry that will evoke this idea of a whole new type of diabetes when it isn't.
More drugs for that.
Yeah, that's right.
Absolutely. And everything we're trying to show is that, again, comes back to metabolic health, which comes back to insulin resistance. So let's get that connection clear, and whatever terminology we can do to support that is the right terminology, right? That's right. So is there anyone else on the lineup, or is there anyone you want to meet that you haven't met before? That was a question I had for you. There is. I believe, in fact, you'll correct me, Joanne, what's her name? Jane Buxton is going to be there, right? Yes, she is. Yeah, I've wanted to meet her ever since I really enjoyed her book, the Plant-Based Con. I really enjoyed that.
looking forward to giving her a good firm handshake. I'm not much of a hugger, but I'll hug anyone who insists, but I'm a high five or a handshake sort of guy.
Okay, well, that's good warning for everyone coming along.
Yeah,
But yeah,
yeah, I'm not
Jane.
going to turn anyone away, but we'll go high five.
Yeah, Jane is actually chairing the panel on the second day relating to the effect of beef on the environment. And so we have some interesting
I'm looking forward to that.
environmental
I do feel
contributors.
very, very strongly about the push of to try to get humans to eat a diet that is not a diet that we are built to eat. I feel very strongly about that, and all the people that are at play here, and I'm thrilled that we're devoting time to talk about this.
Yeah, thank you. We're so excited about that as well. Um, so I was just going to mention a couple of things. There's one question that came through. People are asking if this is open to the public. It 100% is. So please do come along if you're in the UK. But also, it's very exciting for us to also share that on Thursday, we're going to be releasing live stream tickets. So people who are in the UK that can't make it, or anyone else, anywhere else in the world, we will be offering you the chance to live stream into the talks on the Friday and Saturday, 19th and 20th of May. So watch the space, and there'll be details being shared on our website, phcuk.org, on Thursday. So that's really exciting. So I know a lot of people are interested in the plants panel as well, and all the talks you're talking about, and the cancer talk as well is going to be so great for people to be able to see the conversation between yourself and Sophia Clemens.
And yep, Sophia is going to be there too. Yeah, I'm fascinated by her work, and I invite anyone. I think anyone who's not familiar with Sophia Clemens' work with cancer, it's pretty remarkable.
Yeah, it is all of the paleo medicina results that she's having in her clinic. So she'll be sharing all of that. And then we've also got Andrew Scarborough, who is a survivor of a life-threatening brain tumor, who used the ketogenic diet to manage his condition. So he's talking as well on cancer. And then there's a panel with yourself included on that, Ben. So yeah, we think the cancer message is so important. It's probably one of the lesser known metabolic illnesses, or it's seen to be linked to a metabolic origination than some of the others. I think people kind of clear about diabetes are starting to get familiar with the concept of Alzheimer's, but I think cancer is one that's maybe a little bit behind the curve when actually it's such a big one that we should be tackling head on as well.
Yep, agreed. Yeah, it's definitely a delicate topic because the initial origin point of cancer is absolutely still not understood. Yeah. And so I always try to speak about that very delicately, where I do not claim that insulin resistance, for example, is causing the cancer, but it certainly is fanning the flames. Yep. The fact that breast and prostate cancer tumors will overexpress insulin receptors, the average individual who has cancer in them, unfortunately, due to how they live, they are making the problem significantly worse because they're not only eating a diet that is overwhelmingly carbohydrate, which is providing an abundance of glucose to the cancer cells, which is the fuel that the cancer cell is primarily using, but at the same time, the cancer cell is mutating in a way often that makes the cell more responsive to insulin's growth signal. Combining that with the fact that the average individual has elevated fasting insulin levels, which is itself reflective of insulin resistance. So the insulin is stimulating a more accelerated growth of the tumor, and the glucose is providing all of the fuel that the cancer cell would need to actually, fuel that growth.
Yeah, absolutely. So we can't wait for that panel as well. There's such an important one. There was one question that came through which someone asked about, does the order of how you eat different foods, can that have a benefit in terms of reducing the kind of glucose spike that you would see in your blood? Is there anything you'd like to comment on that one?
Oh, for sure. Yes. There was, in fact, some human studies that directly addressed that question and looked at the time point in which carbohydrates were consumed. And the takeaway is that carbs should come last, when possible. That if you are eating a meal that has mixed macronutrients, so proteins, fats, and carbohydrates, the glycemic impact is significantly blunted if the carbs come at the end.
Excellent. Well, that's really useful information for people to know as well. So So Ben, we're really looking forward to seeing you in a few weeks' time. I just wanted to ask you one last question, which is, what is your view on organisations like the PHC? There are similar organisations across the world, and having described what we're all trying to do, it's all pretty similar. How do you see us fitting in, the grassroots and the public policy makers in general? What role do you see these organisations playing?
Yeah, so I'm actually unaware of any other nonprofit that's doing this, at least to the degree that the PHC is doing, and I have enormous respect. Born from two origins. One is my respect just for the individuals. I have known Sam Feltham for years and David Unwin for years, and I have just enormous respect for these men as just good people. Which seems increasingly rare these days. May I be considered among them in all sincerity, but also rigorous in their approach. I know Sam has really made wonderful efforts on his own and getting some of these efforts published in the peer-reviewed journals. But then Dr. Unwin's contributions, my heavens, we almost can't say enough about what he's able to do in his own personal story and his renewed love for practicing medicine in a way that he had always wanted to, but never quite been able to. And then him sharing the incredible success stories, which deservedly has earned him respect in the UK within the medical field. I think that's much of my enthusiasm for PHC and indeed my own participation. And I'm genuinely humbled by the invitation when Sam first reached out, because I have such respect for the organization. These are good people who, at the same time, are making truly meaningful contributions to how we understand human metabolism and its role in disease.
Oh, that's really nice of you to say that. And Sam and David will be very, very pleased to hear all of that. And we have a number of scientists and volunteers that work across the UK. We have about 200 ambassadors that are working on the ground to help people understand these concepts as well. So it's growing, and we're really hopeful. And thank you for your help in bringing that message out even further. Is there anything you'd like to say before we end about yourself, and maybe if anyone, obviously you're on Instagram, but anywhere else that people can be directed to follow you more?
Yeah, well, no, my only final part is I hope that this ends up being a very, very popular event. Anyone who has any chance to get there, please come. Please come. Give me a high five. Let's take selfies if you're interested. And I won't
Not
force
hugging.
it, of course. Yeah. But I would love to see a lot of people there. And those where it's just not feasible because of travel constraints, then please join us live. It is a wonderful panel. And I don't think no one's going to regret participating in this.
Thank you so much, Ben, and thanks for joining us tonight. So we'll leave it there, and thank you to everyone else. Look out for some more Instagram lives coming up.
Wonderful.
So have a lovely evening, everyone.
Thank you. See you guys.
See you soon, Ben.